Welcome to Health Alert. I'm Pam Butler. Today we're going to talk about chiropractic care, and joining me is Dr. Matt Hunt. He's with Hunt Spinal Care. Welcome to the program.
Thanks for having me.
Now, before we start, tell me a little bit. I'm going to throw you a little bit of a curve, but not too much.
Okay.
How does one become a chiropractor? Because you are a chiropractor. So tell us, how do you take that path if you're interested in that as a profession?
Okay. First step is to get your undergrad taken care of. It's a 4-year program in most states that you have to go through before you go to chiropractic school.
Okay.
And so you have to get all of your prereqs done and get all the sciences and all the things that are required at chiropractic school. And some schools actually require different prerequisites than other schools.
Okay.
So you want to make sure that you look into that before you head that direction. And once you get to chiropractic school, most chiropractic schools are a 5-year program, but they wrap those into, you can go year-round, and it'll shorten that down. So the school that I went to, you could get through in about 10 and a half, or excuse me.
Don't say years.
Yeah, 10 trimesters is what it is.
Okay.
Which makes it about 3.5 years.
Okay.
Yes.
Now, with chiropractor, once you go through the program, is there a state certification or a national certification? Tell us a little bit about that.
There are both. In the state of Oklahoma, you have to go through a national boards process, and then there's an Oklahoma board process as well that you have to be licensed in the state of Oklahoma, as well as at the national level, you have to pass certain tests to be able to make it.
Okay.
Yes.
Now, if someone, because we're going to talk about sort of the specifics of chiropractor in terms of what you really do.
Yes.
But if someone is looking for a chiropractor, what kinds of things should they look for? Should they ask them? Are they board certified? I mean, what should they really do?
My best recommendation is to talk to friends and family that have been to a chiropractor. You know, I've heard way too many stories about people that have called out of the phone book and got a bad plumber, or
Right.
or called out of the phone book and it's just like that with every profession. You want to make sure that the chiropractor that you're going to is actually going to meet your needs, because there's many different types of chiropractic within the field of chiropractic.
Okay, then when we look at chiropractic, let's sort of break down what it is that you really focus on, or sort of the scope of it. First, I want to start with age.
Okay.
What's the age range? I mean, do you see infants? Does it have to be where you're 18? I mean, tell us about the age range that a chiropractor can serve.
Okay. The best way to break that down is with the different levels of chiropractors.
Okay.
Different chiropractors have different specialties or areas that they're more geared toward.
Okay.
Now, in my practice, I've seen 1-day-old babies. I've seen all the way up to a 96-year-old. That's the oldest one that I've had the opportunity to work with. So in my practice, I have a very gentle approach to chiropractic. So it's a much easier transition to be able to help the infants, as well as the entire family, as well as the geriatric and older patients.
Okay, so it's just like a physician who may specialize in pediatrics for children or geriatrics for the older population. Like you're saying, the chiropractor will specialize sometimes too, or be a generalist.
Correct.
Okay. Now, when we think about chiropractic, tell us exactly, what is it? Because sometimes people have sort of ideas. You talked about you practice it in a gentle kind of way.
Yes.
Sometimes we may have visions of, you know, the machine and it's cranking you apart or different things like that. But what is chiropractic? I mean, what is it?
Well, in general, there's 2 different types of chiropractors that are out there, and I'll just go into that just quickly. There's a limited scope chiropractic, where those are the doctors that are focusing specifically on pain and pain-related issues. And so, you know, we all see those, even the other type of chiropractor. But there's a limited scope that just really focus on the pain. And we're great at getting rid of headaches, neck pain, low back problems, if you're a candidate for that, and that's what the evaluation is typically for on the initial visit. Now, the second type of chiropractor is more of a wellness chiropractor, where we focus more on the health and empowering people to become healthy and staying healthy, and teaching people how to avoid getting back to the same point they were when they first came in. And so with the wellness chiropractor, most people still come to us initially with pain, you know, headaches, neck pain, low back problems. But then they will also transition into more of a understanding of what we do and trying to stay healthy and make sure their spine stays aligned for their long term.
Okay, so if you're practicing wellness,
Yes.
just like we do for our physicians when we should be going for our yearly checkups and things such as that.
Correct.
Can a person look then at chiropractic care based on what you're saying as just going in for kind of a checkup?
Absolutely.
To kind of see what's what before you're getting, even if you have no pain or these things like you're saying, so that you're really starting on the front end to get an assessment of what the person may really need to get some prevention. Is that?
Yes, yes. Well, the way I like to explain things to people is only 1/9 of our nerves are telling us about pain.
Okay.
So the other 8/9 are controlling organs, glands, tissues, and muscles in the body. And so the pain is usually the last thing that shows up for people.
Okay.
And so when we educate patients that there may be other things that are going on, you could be having digestive issues because the nerves coming out of the mid-back that are going to the stomach aren't functioning properly, then that begins to give them a little bit better idea of getting more function to that area, the nerves functioning to that area is what we work on.
Okay. Now, if a person's coming in then in this general sort of assessment, what can they expect for a chiropractor or in your practice? Do you do x-rays? I mean, exactly what happens?
Okay, I can explain what I do.
Okay.
Because everyone has their own broad spectrum of what we can do. The main thing that we look at is trying to find out if there's nerve interference. And so we do several exams and tests to find out how that's working for people. You've always heard of the chiropractors doing the long and short leg test.
Right.
Okay.
Right.
We actually do that, but we try to explain it so that they know that they really, most of the time, don't really have a long and short leg. We're really looking at the functioning of the muscles from one side of the back to the other. If the muscles aren't functioning properly, the muscles will be attached to the hip. They'll pull the hip up and make a leg appear short when they're laying on their back. Okay, so we do that test, and then we analyze their body posturally from the back to find out if they're leaning to one side. I have scales that I measure to see if they're leaning to one side more than one side than the other, and then visualize a twist in the spine. And then I also have hip calipers that I measure. Typically, if that hip's pulled up on that side, when they stand, it'll actually drop on that side.
Okay.
And so they'll lean to that direction. So those are the few simple, quick tests that I do at the office.
Okay. Is there anything, let me ask you this, in terms of history that you take? Because if you have maybe family members, especially parents or aunts or lineage kind of thing, who've tended to have some issues of posture or different things like that, are those kinds of questions that you ask people as well to get some idea of whether this is maybe a genetic component of something, or we do that in the regular doctor. So
right,
so
sure.
Does that encompass your practice too?
Yes, of course. The initial consultation is very important. A lot of the intake information that we have covers a lot of that. So I don't spend a ton of time asking those specific questions, but with the intake information that I get, I spend time looking over that and making sure that there aren't any specific questions that need to be asked about that. Because of course, like you mentioned, if you have genetic predisposition to something, then you need to make sure that that's addressed, and make sure that if mom has some major scoliosis issues, then we're going to look at that as seeing if it's a predisposed condition for the child or even as an adult.
Okay, well, what we're going to do is take a really quick break and come back, and I want to pick up on scoliosis since that is one of those major back issues, and have you sort of tell us what it is exactly, and then just look at general back care in terms of what you can provide.
Sounds great.
Please stay with us. We'll be right back.
Turning a 20-foot wall into a canvas takes vision. So will getting into college. I've got what it takes. So do you.
Clean kitchen surfaces, utensils, and hands with soapy water. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
So, I got this new family, and I don't know what it is about this one, but she can't seem to put down that toy. Oh, and she even talks to it. Who's she talking to? Her mom? She talks to her mom a lot.
Welcome back to continue our discussion talking about chiropractic care. Joining me again is Dr. Matt Hunt with Hunt Spinal Care. Let's jump in. Now, I want to get back before we go to scoliosis to define what that's all about. Tell me a little bit about, because we kind of went to break before you got to that, this concept of x-rays and how do you incorporate those in any other testing?
Yes. Well, the first couple of things that we do after the consult, like we talked about, and the initial exam, we also do what we call our Insight Millennium testing to find out how the nerves are functioning out of the spine. As I mentioned earlier, 8/9 of the nerves are controlling organ, glands, tissues, and muscles. And so we want to make sure that we find out how those are functioning out of the spine as well. So we have an instrument that measures how the muscles are coming out of the spine, how the muscles on each side of the spine are functioning, making sure that they're balanced, and then also to find out how the nerves functioning out of the spine are going to the organs and glands and tissues. So we have a great baseline before we even get into taking x-rays.
Okay.
And once we do these exams and we find that there's a need for x-rays, we take x-rays to find out exactly where everything is before we get started.
Okay, so the x-rays are really coming as a result of the other findings, whether or not you would even need to have one.
Correct.
Now, before we get to the scoliosis, one other quick question. The assessment that you're doing, is the individual going to know this the exact same day, or is there like a lag time of a day or two or something like that before you can then give them the results?
It depends on the patient and the time frame that they have for us. Most of the time, we will see it over. We'll see them on the initial consult and exam, and then we'll do the report of findings on the next day or later down the road. Now, a lot of times I have patients that travel a distance and they don't want to go back home and come back. So we will send them to. They'll may go to lunch, and then after lunch I'll come back and do the report of findings and go over everything that we found with them.
Okay,
Yes.
excellent. Okay. Now, I want to get into some specifics of the back, but talk about one area in general in terms of scoliosis. Tell us a little bit about what is scoliosis, how can parents or caregivers look for that, test for that, to also get some medical intervention in terms of whichever direction they go. What is the scoliosis?
Okay, scoliosis is a couple of components. It's not just the curvature of the spine, but it's also a rotation component to the spine.
Okay.
And so that's something that a lot of times people will, parents will notice, in the summertime, whenever they start seeing their 10 to 12 to 13-year-old boy or girl in a bathing suit, because it's not something that we always see our children in just a bathing suit or from behind. So we start noticing the shoulders are higher or lower, or the hips are higher or lower. Okay. The shoulder blade, scapula, will stick out higher or lower than the other, or stick out a little bit. And those are just kind of some warning signs that there may be some curvatures going on in the spine. Scoliosis itself is defined as a curve in the spine that's measured on x-rays of greater than 10 degrees.
Okay. Now, with chiropractic care, in terms of general back care, there's no really specific chiropractic care for scoliosis
That's my
that we
understanding.
kind of know of.
Right.
Okay. So in general, if a person's coming, whether it's scoliosis or general back pain,
Yes.
like lower back pain that many of us have, especially as you get older, those kinds of things, what can chiropractic care kind of do for us in that arena?
Sure. The best way to explain it is when there's pain or there's some structural abnormalities, what we can do is we're able to align the spine to get everything functioning properly again. So nerve flow is very important. If there's just a little bit of pressure on a nerve, it can cause a significant amount of pain. And when bones are out of alignment, putting pressure on nerves, chiropractors are trained and are the only people that are trained to remove the pressure off the nerves to allow the spine to function properly without surgery.
Okay, now is this, in terms of what you do, is it with spinal manipulation? Is it just a kind of, because people wonder, is it a massage technique? Is there some machine that you get connected to for so many minutes of the visit, or you take a machine home with you to kind of help you stretch out? I mean, exactly what do you do?
It's a tough question because I can tell you what I do again.
Okay.
But like I said, there's about 100 techniques, over 100 of techniques of chiropractic, probably closer to 200 techniques of chiropractic. And so there are doctors that use instruments
Okay.
that'll use a little activator gun is what they call it. There's also some that use other instruments. Most of us use our hands, and that's the way I correct the spine. It's a very gentle approach, like I mentioned to you before. And it's there's techniques. One of the techniques that I use is NUCA, and it's an upper cervical technique where we use a very gentle approach to the top bone in the spine that corrects the entire spine.
Okay.
And then I also have another technique that I use that's a cranial sacral technique, which is much different than any other chiropractor in our area.
Okay. Now with this, are there certain kinds of exercises that the individual goes home with that they should be doing to kind of assist with this type of correction, or is it just in the office only?
Well, that's a good question, and it depends on the patient.
Okay.
Some of our practice members are coming in, and there's no way that they're going to be doing any exercises right away. And so we work on taking the pressure off the nerves, allowing the body to function the way it's supposed to. Now, the person themselves doing the exercises at home, which we do recommend at times, will be more for strengthening and stretching, because when you have a person that their head is forward in front of their shoulders, it puts pressure on their neck, and every inch that your ear is in front of your shoulder puts 10 to 20 pounds of pressure on your neck.
Now say that one more time.
Yes. Every inch that your ear is in front of your shoulder puts
Okay.
10 to 20 pounds of pressure on your neck, depending on who you talk to.
Okay.
And so with the computers and the iPhones and the PDAs, we've got this huge anterior head carriage thing that's going on that's causing a lot of problems.
Okay, and I did see that in terms of, especially youth, with all of the absorbent texting that they're doing, how the curvature in the neck is not there.
Correct.
It's being, it should be kind of mildly curved, right?
Yes.
But it's not.
Yes.
And that is presenting a lot of pain and discomfort, of which they do talk about having chiropractic care or other exercises where you're kind of laying your head over a table.
Right. Well, there's
to kind of assist.
For sure. Yeah, and a lot of the exercises that I give for the head and neck are specifically for that, because a very large portion of the population have either a straight neck or a reverse curve. And that's something that most of us have just because of our occupation or how we're doing things, or we didn't listen to mom when we were little to sit up nice and tall.
There we go. Okay, now with this, and because you talk about the manipulation, you did say that you've seen sort of clients as young as a day or so old?
Correct.
Now, what in the world, people will ask, what could an infant of that age really be dealing with? Or tell us.
Okay, good question. Well, one of the most dramatic things that we go through in life is the birth process for the baby itself. And so we're going through a very small opening, and a lot of pressure is being put on our head, and a lot of our babies are stuck in there for quite some time before they even get into the world. And so what we are doing is we're just doing an exam, we're just doing a check to find out how the nerves are functioning. It doesn't mean that baby actually gets a correction on that visit, but the patients that the small one-day-olds that I've seen in that position have been just their moms are concerned that they want to make sure that their baby is going to function at 100%.
And that's that wellness approach and prevention, which is so critical and so key.
Yes.
Okay, we're going to take a really quick break and come back and focus on a couple of other areas.
Sounds good.
Please stay with us. We'll be right back.
The forest is a magical place for your whole family, with animals and fun all around. So discover the forest and explore all the wonder that's there. Visit discovertheforest.org to find a forest near you.
The 9/11 memorial is for my 343 brothers who didn't make it.
And for my brother.
This shows the world that we can rebuild.
And that we are strong.
It's for the heroes like my dad.
This year, the National September 11th Memorial opens in New York City. Join us to honor, remember, and reunite. You can help right now by texting the word HOPE to 80088 to give $10.
Welcome back. To complete our discussion, talking about chiropractic care, joining me again is Dr. Matt Hunt. He's with Hunt Spinal Care. Let's jump in. Now, I do want to ask you in relation to looking at issues such as headaches because people may think, well, I need a pill.
Right.
So tell me a little bit about what chiropractic care can do for us with headaches.
Sure. You know, I had a practice member that came into the office this week specifically with headaches and dizziness issues. So what I found after an exam was there was pressure in a very delicate area in his neck called the brainstem. When there's pressure on the brainstem, it can cause a significant amount of problems in many different areas. For instance, after taking specific x-rays on this young man, I found that the top bone was moved one direction, the bone below that was moved, rotated the opposite direction as the bone above, which is going to be definitely causing a decrease in blood flow to the head, as well as the pressure on the brainstem. And that is one thing that we will see with headache patients is the pressure on the brainstem is causing the body not to function properly. The decreased amount of blood going into the head will cause problems with dizziness, will also cause problems with headaches as well.
Okay, now with some of these corrections, because people want to know that too, once you have a, quote, correction, other than wellness kind of checkups, is it taken care of or can it come back again? Of course, I know with texting, for instance, if you continue to do that, of course, whatever correction you get is going to be worked out unless you maintain certain things or do things differently.
Right.
But in general, is a correction a correction? Is that like it?
It's not usually it, unfortunately. Okay. It is one thing, it's a lifestyle. It's a lifestyle thing that we have to go through. It's similar to going to the dentist and getting your teeth cleaned, okay? Now, once you go get your teeth cleaned and maybe you haven't brushed your teeth in a while and the dentist has to do a major cleaning and take care of everything, hopefully you won't wait another year to brush your teeth.
Right,
you know?
right.
It's something that you need to maintain. You need to brush your teeth, you need to take care of yourself, you need to floss your teeth, and avoid the things they tell you to avoid. And that's similar to the chiropractic. Once we work on the spine, we'll get it corrected, but it's been there for a long period of time. And so it's not one thing that we say, come back and see us a year or even 6 months. Some chiropractors will check you daily for a while. Some chiropractors will just check you a couple times a week and those types of things just to make sure that it's stabilizing and holding. Okay. The chiropractor can be the best chiropractor in the world and make the best correction, but it is up to the patient's muscles and ligaments to hold it there.
Okay. Let me ask you another question in terms of sports and how chiropractor can help with people who play sports, especially contact sports. I remember my son, when he played football, had a lot of lower back pain and issues like that. And we did go to a chiropractor and did help tremendously. But in general, tell the viewers about that related to sports.
Sure. I have practice patients that come in and they only come in for pain. And some of them are children. Their parents will send them whenever they have a contact injury and fall off the trampoline. They're playing football and they've had some hard injuries. I also have patients that will come in for wellness care. I was explaining earlier, just making sure that when you're in a collision or in some kind of a contact sport, if your body is optimal, you're going to be able to sustain a much larger injury without actually getting injured.
Okay, so it can be preventative from that way. Like you said, it helps correction and you're doing the strengthening in that area, so the two together are the best combination to try to prevent injury, that without those you may sustain it.
Very, very true.
Okay, let me ask you about another area, allergies.
Yes.
Can a chiropractor help with allergies?
In
terms of your practice,
okay.
Because in general.
Under what I've seen in my office, I have patients that do come in that suffer from tremendous allergies. And correcting their spine and nervous system allows their body to function better, hopefully at 100%, and they're able to handle the seasonal allergies and those different types of things that are out there much better.
Okay,
yes.
So that in combination maybe with other prescriptions, because of course we're not advocating to anyone that if you're under the care of a physician for certain kinds of medications, etc., that you just stop that.
Oh, absolutely.
You continue that this is something that is assistive. And on that measure, do you interface with the person's physician depending on what kinds of issues they're coming in with?
I have in the past, but it doesn't happen very often.
Okay.
Yes, and I'm willing to do that, but that's one of our questions that we ask. Would you like us to share this information with your medical doctor? And are we able to talk to your medical doctor about this information? It's more times I will actually get information from the medical doctor and try to find out what the MRI said and those types of things to find out where things are at, as opposed to me sending information to them.
Okay, so it is kind of a coordination between,
it
can be between your primary care provider, depending on what your issue is, like I'm saying.
Yes.
And the chiropractic care that's being received.
Yes, yes. I had a gentleman that came in this past week that had steroid injections in his low back, and he told his medical doctor, I don't know what specific medical doctor he was, but he told his medical doctor that he was coming to see a chiropractor, and he was excited that he was seeing me. And he went in this past week, and the pain was not there, so he didn't get the steroid injection that he had been getting over the past year.
Right.
So
and so in time, it can help diminish some of your medication needs potentially for pain or things like you're saying, the steroid injections for pain and that.
Yes, for sure. And we've also, there's chiropractic studies that have been done and double-blind studies that have been done about chiropractic that can help lower even blood pressure medicine. Yes.
Okay.
Better than 2 medications taken at the same time. It was a WebMD study that was done several years ago.
That's excellent. Now let me ask one other quick question here. Foot pain. We've done back, head, and other things. Can chiropractic care help with your feet if you're having foot pain or foot problems?
It can.
Okay.
It has to do, depending on what the issue is.
Right.
I had a patient in the office yesterday that we talked about plantar fasciitis. Me adjusting the spine and neck isn't going to help his plantar fasciitis, but there's information that I could give him that would help his plantar fasciitis to get better sooner.
Okay, now let me ask this other quick question, because I know, based on a presentation you did before, nutrition. You incorporate a lot of information, and you have a nutritionist, dietitian in your office.
Yes.
With your practice. Tell us really quickly about the role and why do you have such a person in your office, which is kind of unique.
Yes, we try to take a 3-pronged approach at everything that we do. With chiropractic, there's 3 main things that will cause us to have problems. There's emotional, which we don't do at our office, but we have referrals that we refer out to. Nutrition, diet, nutrition, those types of things, as well as physical. And so I'm able as a chiropractor to be able to help with most physical ailments and injuries and those types of things. And I specialize in that specifically. And that's why I brought in a dietitian and soon to be a nutritionist in the office. And what they are able to do is help out with the diet side. They're able to do a quick analysis, a thorough analysis actually, on how the body is functioning, find out if there's any toxins in the body that need to be taken out, or if there's any specific nutrients that need to be added.
Okay, and because sometimes we can get into trouble because of our nutritional deficits that can lead to other problems that appear to be physical, but their origin may be more in the nutritional, deficit of what you're not taking, such as like dehydration.
Right.
We can get into some physical problems because we're dehydrated.
Yes.
So you correct the dehydration, it can correct the physical problems.
Yes.
Okay, well, I appreciate you being here, and thank you for all the work you do and helping all of our body parts.
Absolutely. Thank you for having me.
Thank you.
Right.
Well, that's our show. For Health Alert, I'm Pam Butler. I'd love to hear your questions, comments, or suggestions for future shows. Please write me at Health Alert USA, P.O. Box 50913, Tulsa, Oklahoma 74150. Or if you're on the email trail, please email me at healthalertusa@gmail.com. And also visit me on YouTube at youtube.com/Health Alert USA. And remember, check into your pains and ailments and prevention. Consider chiropractic care as part of your overall wellness. Take care.